1, 2, 3, 4. Well, you got it.
Hello, I'm Joanne Borris, the Housing Programs Administrator with the City of Kingston's Housing and Homelessness Department, and I'm here to tell you more about the homelessness system.
Starting us off once again is Kingston's own The Merengues, with the track Tell Me Twice from last year's YGK Music. Find this track and many others at CityofKingston.ca/YGK Music. Welcome to Tell Me More, the City of Kingston podcast. I'm Rob Hosier, your host and a communications officer here at the City of Kingston. To my left, physically distanced, masked, and furiously pushing buttons is our producer Paul Whittingham, also a communications officer here at the City. And of course, you heard from our guest at the top of the episode. That's everyone deep in the Councillors Lounge here in City Hall, but most importantly, I want to welcome you, our listeners. Thanks for joining us on Tell Me More, the City of Kingston's podcast, its first ever municipal podcast. If you caught our first episode with City CFO Desiree Kennedy, welcome back. But for those of you joining us for the first time, let me tell you a little bit about it. Tell Me More is a podcast where City of Kingston leadership and staff will go behind the headlines to tell you more about the larger context surrounding current issues, initiatives, and decisions that are shaping our community. You'll hear the behind-the-scenes stories and better get to know the people who are working for you. So if you're looking for a broader municipal perspective or just to spend some time with some really interesting guests, you're in the right place. So please like, subscribe, rate, all that good stuff wherever you get your podcasts. So now that you know what the podcast is all about, let's not keep our guests waiting any longer. I'm really excited because, full disclosure, I'm the communications officer for Housing and Social Services and consequently Homelessness Services. Joanne and I have laughed together, we've cried together, and she is really one of my personal heroes. City of Kingston Housing Program Administrator Joanne Borris, who's going to tell us more about the homelessness system. Welcome to Tell Me More, Joanne.
So tell me you'll take me home tonight. And tell me where you've been all my life. Nothing you say feels right.
So Joanne, tell me, how long have you been with the city?
I've been with the city now for about 2.5 years.
2.5 years. So before the city, what were you doing then?
Well, I've worked in the homeless services sector for most of my career, about over 20 years. So I was managing a couple of larger shelters out in the York region before I came to Kingston.
Okay, so you've been in this line of work for quite some time now.
Most of my career, for
Most
sure.
of your career, and we're not going to put a number on that.
Thank you.
So what originally drew you to this line of work to help individuals experiencing homelessness?
Well, I think for most of us who do this line of work, it really is heart-led for a multitude of personal reasons. I have my own personal reasons and people close to me that have experienced homelessness in varied ways. And so in an effort to bear witness, to actually make change and to work towards a goal of ending homelessness, but also of dealing with marginalized people in a much more human and kind manner, that's what's really brought me into this line of work, and it's what drives me forward.
Absolutely. Like you can't have a more noble reason for this. So in doing this line of work, what does a typical day look like for you at Housing and Social Services?
Well, unfortunately, there is no typical day because we're dealing with human beings and organizations who are constantly in some type of flux situation. So it could be anything from answering phone calls, a lot of Zoom meetings of late. I'm very fortunate that in a lot of instances I do get to go on site and be frontline and actually engaged with individuals who are experiencing homelessness and the service providers that work with them. So my days can be varied and I can be in a lot of different places in one day.
Keeps it exciting, though.
Absolutely.
You don't know what you're going to face every day. So given that long list of things and areas you're going to be in, I agree, Zoom meetings are starting to take over our life. And it's so good to have you face-to-face here in the Councillors Lounge, although distanced away, but I haven't seen you on screen for months now and not in real life. But given all the things that you do in your day, what is your favorite part of your job?
Well, I have to be honest that I do love being on site, frontline at the organizations that provide the services to our individuals, being able to interact face-to-face, socially distanced with individuals at the shelters or through service providers. That's what keeps me going, and that's my absolute most favorite part of any workday, if I'm able to do that.
In communications, we know that an important part of productive dialogue is sharing the same language. You may have differing opinions, but if you can't agree on the meaning of what is being said, things fall apart really quickly. With that in mind, Joanne, can you define for me and our listeners what the homelessness system is?
Yeah, the homelessness system is made up of programs and services to support individuals who are at risk of or who are actually experiencing homelessness. The system's made up of a number of different organizations, charities, advocates, and individuals who are supporting people who are experiencing homelessness, including food support programs, mental health and addiction supports, skills development, anything else along those lines. The city's homelessness services are part of this too, and they're more focused on a housing first model.
Okay.
So home-based housing, Kingston Youth Shelter, the Integrated Care Hub, and Salvation Army, they all provide resources and supports to individuals within the community. So we provide things like prevention diversion supports to try and help people avoid homelessness, emergency shelter for adults and youth. There's transitional housing, a small number of supportive housing units for adults, and funds to help individuals who might have rent arrears, utility arrears, or might just be finding themselves in some financial difficulty at the
Covering
time.
the whole spectrum, really, or what we call the continuum.
Absolutely. And all of these organizations work together to help individuals in the community who are at risk of homelessness or who are homeless resolve their homelessness as quickly as possible.
Okay. And the city's role in this greater system is essentially as a manager. And so you help distribute finances and provide oversight and maybe be the go-between between some provincial or federal authorities, or is that an accurate portrayal of the city's role?
Absolutely. We're what's considered a service manager. So that means that the funds are downloaded from the province to the municipality, and we source the service providers, put some pieces in place to ensure that the right services and supports are being provided, and then sort of monitor that through data collection, facilitation, all sorts of different pieces to just try and help the service providers do as good a job as they possibly can.
And you mentioned data collection, and we made huge strides in that recently. Can you speak a little bit more about that?
Absolutely. One of the most recent pieces that we've done around data collection is the adoption of what we call our by name list.
Right.
That is actually a national initiative. So it is going to be a provincial mandate that organizations and service managers are using this by name list, which sounds confusing, but really at the end of the day is an Excel spreadsheet that is a living real-time document of how many homeless individuals are in the community. And that is really important for a couple of different reasons. It's important because we want to make sure that we understand the depth of the problem so that we can create solutions, but also so that we know who the individuals are and that they don't fall through the cracks.
Right.
So service providers are responsible for any time they encounter an individual in the homeless system or someone who might be at risk of homelessness. They're looking to get confirmation from that individual that they're okay, their consent to be able to put their name on that list. If they are, that name goes on there, and then as a collective, we look to working to make sure that that individual's needs are met.
This simple Excel spreadsheet sounds just that's a simple Excel spreadsheet, but this has huge impact for those seeking help. Because from what I understand with the by name list and such, you have what's called coordinated access, in the sense that clients, anyone that's experiencing homelessness or needs those support, can go to multiple points throughout the homelessness system, throughout Kingston and the counties, to receive continuous service, to receive coordinated service. And so if someone was at one location the day before, the caseworker or the individual helping the individual can actually reference that and provide more comprehensive wraparound treatment. Is that correct?
That's correct. It's a sort of no wrong door approach in that individual organizations don't have to pick up the phone or do searching in order to be able to find out what services an individual's already received or what services they might have identified they need. They're able to pull up that by name list and, you're right, take that level of service and support from there and work with that individual based on what they've already received or not received.
It's amazing. And it's not just necessarily a convenience factor. Sometimes it's a survival factor. You're trying to survive day to day. You can't go through the bureaucracy of going, I've got to go here and get sent to here and get sent to there. You need to have a direct point of contact when the service you need it. And so this is such an important aspect of the system that's really getting developed, and it's in its infancy right now. It's always kind of been there, but now it's exploding and getting recognized by, I believe, national organizations.
Yes, we are one of Built for Zero's quality by name data list service managers, actually. And so our organizations take huge credit for that also, in that they're the ones who are responsible for updating it and keeping it updated literally on a daily basis.
And the other last exciting aspect of this, I'm sure there's many, is the fact that we could also work on some data visualization on websites or reporting to council and to the community and such, where we're able to give accurate and live numbers on things like shelter usage, on all sorts of important aspects on that, and so decision makers can make data informed decisions on homelessness, which is absolutely essential.
It is, but also to that part too, it's for the community. We get a lot of questions, more questions than you might imagine, sort of from interested community members about, well, what is the shelter utilization? Are there beds available? You say
Sure.
there are, but what does that look like?
Right.
So we want to be as open and transparent with everybody that we possibly can. So, it's been phenomenal to work with communications on building those web pages that, hopefully within the next 6 to 12 months, those will be available, that if anybody has those types of questions, they can log on, have a quick look, and get real-time information.
So it's hard to host a podcast in 2021 and talk about an issue like homelessness and not mention COVID-19, the pandemic. Can you tell me a little bit more about how the pandemic impacted vulnerable individuals here in Kingston?
Absolutely. COVID-19 had a massive impact, not just on homeless individuals, but especially those at risk of homelessness. So we've recognized that it's shone a massive spotlight on the plight of individuals who are homeless within the community, especially when you have a stay-at-home order and nowhere to stay at home. So the reality is that in order to ensure the safety and security, not just of the individuals who are homeless, but of staff that work with them, lots of programs and the shelter systems themselves had to actually change the way that they do their work in order to try and maintain some level of safety and security for everybody involved. So it was really difficult to have to reduce some shelter bed numbers in order to socially distance. Individuals who don't have a home and might be symptomatic need to be able to isolate and await test results. So we've had to create spaces for them to be able to do that are staff-led and managed so that they have the right supports in place. And for those who might be somewhat at risk of homelessness, if they've lost their jobs or been unemployed during this COVID pandemic, then one of the things that we're looking at is the possibility of an influx of newly homeless individuals who, once they can't pay their rent and evictions are occurring at a much rapider pace, they will lose their housing and will be added to the system that is already in crisis.
Absolutely. And a result of some of this is the Belle Park situation. For listeners who are unfamiliar with the Belle Park Encampment, can you paint us a little bit of a picture of what happened there?
Absolutely. Belle Park, about a year ago, sort of morphed from what we understand from clients, was a concern around being in a communal living environment when COVID-19 was just beginning. So I understand that there would be a lot of concern around your safety, your personal safety, if you were living with a large cohort of other individuals and not knowing who's sick and who's not sick. So we started to see people who opted to, rather than stay in shelters with some of the rules they had around social distancing and staying in the shelter due to a stay-at-home order, we started to see individuals looking at other ways to find methods of surviving. And we started seeing tents pop up. And at Belle Park, it very quickly went from one to, at its largest, over 40 tents during the summer months.
Right. And that creates a problem. And in particular with this site here too, I believe there was environmental concerns as well about staying on that particular piece of property because of where it was located, former landfill, I believe.
You're correct. So the actual park itself, the green space, is a former landfill that is in the process of remediation, or will be shortly in the process of remediation. So what we really had to be concerned about was ensuring that individuals stayed off of that contaminated land and more on the parking lot area. But as you know, it's not that big a space, and so socially distancing in tents was a little more difficult than anticipated for individuals. But we were very fortunate that those who were residing on site were provided with a lot of supports in place from the community and service providers to try and ensure their safety and well-being during that time.
Speaking of this amazing support from community providers, I got to see it firsthand. Everything from medical treatment to waste facilities, bathrooms, the whole bit. But what did these community partners and yourselves learn by working with the men and women camping at Belle Park?
You're right. There was a phenomenal output of support and services from the community providers, the city departments themselves, a collaboration like I've never seen before. So one of the things that we really wanted to find out and take the opportunity to learn was why would people rather be camping than in a safe building and being supported by staff. So we undertook a needs assessment of clients who were willing to chat with us and really engage with them to hear their voices and find out what was keeping them from the shelters, but on a bigger scale too, what did they need in order to be successfully housed and found somewhere to live. So it was phenomenal to be able to take that time to sit with individuals, hear their voices, and start to understand the plight that some of the individuals had been through and what they were hoping for in order from services and supports.
How did what you learned through Belle Park, as a city and as community partners, obviously, how did those lessons translate into impacts of the system, into the homelessness system in general? What has happened since then that can be directly maybe attributed to Belle Park?
That's a great question. I do think that although it was a difficult situation, we were able to learn a lot from it. And it actually, I think, has benefited clients to some degree in that our integrated care hub was a direct outcome of Belle Park, hearing from people that they needed a low barrier, safe space where they were going to be accepted whether they were using substances, regardless of what their mental health challenges were. Somewhere they felt safe, cared for, and respected by staff was key. So the integrated care hub was born as a result of Belle Park, truly, but also the scope of collaboration that our service providers were able to manage and create. They had worked, and all of them agree that they'd worked in some form of silo prior to Belle Park. And although they all knew that they shared the same clients, the collaborative work hadn't been pushed to the degree it was when everybody was in one location and the service providers came together to provide supports. So that collaboration is something that we want to continue building upon and ensuring works for clients, because we can't do this in silos or alone. We've recognized that it's going to take an entire community, and I mean community, not just the service providers, but all of Kingston to help work towards ending homelessness if we're going to do it successfully. So, you know, as traumatic as Belle Park was for everybody who was involved in that situation, the outcomes have led us to system reviews, an enforced need to hear client voices, to create programs and services that they feel are going to work for them.
So circling back to the Integrated Care Hub, or the ICH, it's a purpose-built facility with services that met a lot of the needs that you saw in Belle Park, that you heard in Belle Park. And essentially, this is bringing a new, let's say, population of people experiencing homelessness into your view. Can you define that population just a little bit for us?
For sure. I think what we recognize quite quickly is there is a group of individuals who have either been unable to find housing or unable to maintain their housing once they have found it. And in a lot of instances, that's due to a number of factors. It might be some serious substance use challenges and or mental health challenges, and sadly a combination of the two. So it's difficult for those individuals to even access shelter sometimes. And so they feel as if there are no services and supports that are willing to accept them as they are. The Integrated Care Hub was built as a solution to that. So it is that space where individuals can go and be accepted as they are, and staff will work on with the purpose of stabilization to help people learn how they might need to maintain an apartment, how to budget, how to do some of those more basic pieces in order to be able to find and maintain housing. But what's really cool about the Integrated Care Hub as well is that it really is starting to function as a true hub. So we're able to invite other service providers and partners in to meet people on site so that they don't have to travel to other locations to access services and support. So, you know, we've had nurses and psychologists and psychiatrists on site. We've had case managers coming from other organizations and addictions and mental health workers who will meet with clients there. So clients are getting that support they need in the space they need as they are, and it truly is meeting clients where they're at.
So an instrumental way of lessons learned from the pandemic, from Belle Park, from 2020 essentially too, is the homelessness system review that's currently going on. Can you speak a little bit more on that?
Absolutely. It was quite timely in that a lot of our service agreements with the current service providers that support our individuals in the community end in the summer months of this year. And so, in an effort to renew those, but also because we were hearing so loudly from clients and advocates in the community, we wanted to make sure that the that we were going to be providing in the future is what people need and isn't just based on theory or best practices as we know them academically, but the voices of the clients that are using those services and what they're telling us those gaps might be in being able to find and maintain housing. So we're about midway through that process, which is really exciting. And, we're going to continue to hear the voices of the community, of the clients and the advocates who work with them as we start to make some changes towards ensuring that it's a much more trauma-informed harm reduction approach to assisting people.
That's awesome. It sounds like there's some engagement coming up then if the community is going to be involved in a lot what this review with the homelessness system review. Does that sound accurate, that there's going to be some community involvement in this?
Absolutely. We want to hear from members of the community. As I alluded to in a previous question, we know that it takes a community to actually make this type of social change. So everybody needs to be involved. We want to hear everybody's voices because it touches all of us in one way or another.
So we've got three major things that have happened since 2020. The ICH, the system review, increased partner collaboration. So tell me a little bit more about what comes next.
That's a great question. Ultimately, we're going to continue to work towards ending homelessness within the City of Kingston. That's been our goal and continues to be. We know that there's a lot of challenges that we're going to face in meeting that mandate, but the reality is I think we all have a really renewed focus on trying to do the best work we possibly can and working with clients to that end goal. So there's certain things that we don't have any control over, such as, rental rates here in the city or availability of housing. But what we do have control over is the services that we fund and making sure that people feel that those services are meeting their needs is key. That's what's going to lead to success in the long term.
So overall, it's always been client-centered, but even more so now. That it's going to be a more and more of a client-centered approach because you're addressing needs that maybe in the past you haven't that we never had to address before, or the complexity or the number of individuals experiencing a challenge. And so the Casework Direct approach seems to be getting reinforced at this point.
It really is. And again, what's been added to that mix is a true wraparound support. We need to continue that. We need to not lose sight of those collaborations that have begun and that are continuing and that are really having phenomenal outcomes for clients.
I've seen and I've used the term wraparound support quite frequently. Can you define that really quick for us?
Yeah, what it means is that clients are able to get the services and supports that they need in the moment. So if you're housing someone, we know that to leave homelessness and be in a room or an apartment by yourself can be really, really difficult and challenging, and you feel like you've lost your sense of community, maybe
Sure.
your support network, your friends. To be in an apartment setting like that can be tough. So having the case managers that are there to support with the housing piece, but also if you're struggling with a mental health challenge or an addiction issue, to make sure that there's those supports that are also there to address those needs as we're working on the housing needs is key. To make sure that there is a sense of community and a sense of purpose and that people aren't bored and feeling alone and more isolated because they're now housed. That's the key to ensuring people stay housed. So those are all the lessons that, although I think we might have known them in the past and been able to speak to them to some degree, they really truly have been highlighted and have become the forefront of our moving forward with clients.
But for some, the outdoors is still an attractive option as the weather gets better and better. So let's talk encampments for a few minutes. Individuals choosing to camp in public-private spaces is happening throughout our province and really across Canada. Municipalities and cities are managing these in different ways. There's some overlap and there's some similarities, but recently Council approved an approach that Kingston will be using with the city, bylaw, police, community partners. So really a blanket approach with a bunch of different agencies. So can you go a little bit more into the approach that just got approved by Council that Kingston and its community partners will be using?
Absolutely. So I think most people are aware that the city does have a municipal bylaw that prohibits camping in park space and land. So what we are doing at this point in time is working with bylaw. If there's a tent or encampment identified, bylaw reaches out to our street outreach teams that do work 7 days a week. They will go on site to meet with the individual who is camping or individuals and chat with them. They want to be able to offer them supports and resources aside from camping, so they will know what spaces are available in shelters and what support programs there are, and they'll make those active offers. And if individuals are willing to accept those offers, they'll assist them in getting to those locations.
This is happening all before enforcement happens.
Absolutely. So
Right.
that's kind of like a step one.
Sure.
Bylaw will be involved, though. In some instances, it's bylaw that is notified of an encampment. Sometimes it is street outreach. So it really depends on who's notified first. Bylaw then, if the individuals are unwilling to leave the park location, bylaw will issue a trespass notice. And that trespass notice gives the individual some time to move their belongings and move along, and there is a date and time on that. The goal is that street outreach is going to continue to work with them. So they'll continue to visit and offer supports and continue to offer services and try and assist that individual in accessing those.
But we're definitely hoping for that preventative approach first, which seems like a lot of time and energy is going to be spent on that preventative approach. And then after that, it goes right into really the bylaw enforcement at that point. So we're really hoping that awareness of the services that are being offered and some of the options being offered, that they'll be a little bit more attractive than staying in the park.
That's the whole goal. And again, that's one of the reasons that we're looking at the system review, is to try and ensure that those services are meeting the needs of clients so that camping doesn't even have to be an option.
And I think the difference now is when Belle Park was occurring, we didn't necessarily have a space like the ICH set up, where individuals that maybe couldn't access to shelters or had barriers to accessing some of these resources now have a place to access resources with little to no barriers in a lot of cases too. So that point of contact is there, that resource is there, which we didn't have during Belle Park.
Absolutely. And we're going to try and continue to add different resources once this pandemic is over and ensure that there are spaces that people feel really comfortable in going. It would be ideal if people had those resources where camping didn't even cross their mind.
Unless it's for pleasure.
Unless it's for pleasure. We're happy with that.
Joanne, thank you so much for joining us today to tell us more about this really challenging topic. But I want to give the parting words to you. Number one, any parting words? Number two, what can our community do? We've talked throughout the podcast that the community can help with an issue like homelessness. What can residents do to help this?
That's a great question. I think that if people are interested in this topic, one of the best things that you can do is educate yourself about it. Learn as much as you possibly can from credible sources. There's a lot of phenomenal websites out there, Built for Zero. Even the city's website has a lot of information and links and resources to not just homelessness, but to also the service providers that are out there that are working with individuals. So by accessing that resource, you can find organizations where you might be able to go and volunteer some time or some hours to donate, to advocate. I mean, advocacy is a big piece as well. Looking at ways to assist us in figuring out what services and supports are needed, what gaps there might be, but to also other levels of government, not just municipality, but the provincial and federal governments.
Absolutely. Making
sure that your voice is heard and that you become an ally with those individuals who might need extra supports and services in our community.
And those are great ideas and definitely ways you can make an impact. And is there anything else you want to leave us with today?
I think it's really important to note that, the housing department is a really unique department in that there's not one individual there that doesn't want to see homelessness ended. I know that in a lot of instances, people think that we're incredibly bureaucratic and it can take a long time for any change or momentum to begin. But the reality is we all want to end homelessness. That is the key and the reason that we all come in every single day. So if you have questions or concerns, we're always available. You can reach out to us. Our contact information's online as well. We're happy to answer any questions or provide information. So I really would encourage people to use that resource also.
That's amazing. And we'll have a whole bunch of links and resources here within the podcast publishing. And so we'll have all that information handy as well. Joanne, thank you again.
Thank you so much for your time.
Remember to subscribe and rate us wherever you get your podcasts. If you have a topic for a future episode, tell us more. tweet at City of Kingston using hashtag #TellMeMore or send us an email at tellmemore@CityofKingston.ca. For more on this episode, visit CityofKingston.ca/podcasts. Tell Me More is produced by the City of Kingston's Communications and Customer Experience team.
Another Friday night, but you don't seem to mind. It looks so right, like the last several times, and I know why. Well, I'm gonna be fine, 'cause I'm gonna go out.
After all that municipal discussion, you have to be ready to get involved. And we've made it easy. Simply go to Get Involved Kingston. Get Involved Kingston is our online engagement site where you can share, participate, and engage with projects right across the city. From surveys to open houses to focus groups, there are plenty of ways to have your voice heard. So between listening to Tell Me More and engaging on Get Involved Kingston, you go from being an informed citizen to a woke citizen. Go to CityofKingston.ca and you can't miss it. Paul, we still using woke? Is that a term?